Hey everyone! Welcome back to the channel. Today, we're diving deep into one of the most fascinating and complex systems in the human body, the male reproductive system. Whether you're a student, a curious learner, or just someone who wants to understand how the male body works, this video is for you. We'll explore the anatomy, functions, and some interesting facts about the male reproductive system. So, let's get started. Overview of the male reproductive system. The male reproductive system is a network of organs and structures responsible for producing, maintaining, and transporting sperm, the male reproductive cells. It also produces male sex hormones, which are essential for the development of male secondary sexual characteristics. The system is divided into two main parts, the external genitalia and the internal reproductive organs. External genitalia. Let's start with the external genitalia, which includes the penis and the scrotum. 1. The penis. The penis is the male organ used for sexual intercourse and urination. It's made up of three main parts: the root, the shaft, and the glands. The root. This is the part of the penis that attaches to the abdominal wall. It's not visible externally and is anchored by ligaments. The shaft. The shaft is the long, cylindrical part of the penis that extends from the root to the glands. It's composed of three columns of erectile tissue, two corpora cavernosa on the dorsal side and one corpus spongiosum on the ventral side. These tissues fill with blood during sexual arousal, leading to an erection. The glands. The glands is the cone-shaped tip of the penis. It's highly sensitive and is covered by a fold of skin called the foreskin, which may be removed during circumcision. 2. The scrotum. The scrotum is a pouch of skin and muscle that hangs below the penis. It contains the testes, which are the male gonads responsible for producing sperm and testosterone. The scrotum has a unique function. It regulates the temperature of the testes. Sperm production requires a temperature slightly lower than the body's core temperature, so the scrotum contracts or relaxes to move the testes closer to or farther from the body, maintaining the optimal temperature. Internal reproductive organs. Now, let's move on to the internal reproductive organs, which include the testes, epididymis, vas deferens, seminal vesicles, prostate gland, and bulbourethral glands. 1. The testes. The testes, also known as testicles, are the primary male reproductive organs. They are oval-shaped and about the size of a large olive. Each testis is enclosed in a fibrous capsule called the tunica albuginea. Inside the testes are tiny coiled tubes called seminiferous tubules, where sperm production, or spermatogenesis, takes place. Spermatogenesis. This is the process by which sperm cells are produced. It begins at puberty and continues throughout a man's life. The process takes about 64-72 days and involves several stages, including mitosis, meiosis, and spermiogenesis. Leydig cells. Located between the seminiferous tubules, Leydig cells produce testosterone, the primary male sex hormone. Testosterone is crucial for the development of male secondary sexual characteristics, such as facial hair, deep voice, and muscle mass. 2. The epididymis. The epididymis is a long, coiled tube that sits on the back of each testis. It's divided into three parts: the head, body, and tail. The epididymis serves as a storage and maturation site for sperm. When sperm leave the testes, they are immature and incapable of fertilization. As they pass through the epididymis, they gain motility and the ability to fertilize an egg. 3. The vas deferens. The vas deferens, also known as the ductus deferens, is a muscular tube that connects the epididymis to the urethra. It transports mature sperm from the epididymis to the ejaculatory ducts during ejaculation. The vas deferens is also the tube that is cut or sealed during a vasectomy, a surgical procedure for male contraception. 4. The seminal vesicles. The seminal vesicles are a pair of glands located behind the bladder. They produce a fluid that makes up about 60-70% of the semen. This fluid is rich in fructose, which provides energy for the sperm, as well as prostaglandins, which help the sperm move through the female reproductive tract. 5. The prostate gland. The prostate gland is a walnut-sized gland located just below the bladder. It surrounds the urethra, the tube that carries urine and semen out of the body. The prostate produces a milky fluid that makes up about 30% of the semen. This fluid contains enzymes, citric acid, and zinc, which help activate and nourish the sperm. 6. The bulbourethral glands. Also known as Cowper's glands, the bulbourethral glands are two small glands located below the prostate. They produce a clear, slippery fluid that is released into the urethra during sexual arousal. This fluid lubricates the urethra and neutralizes any acidity from residual urine, creating a more favorable environment for the sperm. The process of ejaculation. Now that we've covered the anatomy, let's talk about how all these structures work together during ejaculation. Ejaculation is the process by which semen is expelled from the penis. It occurs in two phases: emission and expulsion. Emission phase. During this phase, sperm from the epididymis and fluids from the seminal vesicles, prostate gland, and bulbourethral glands are mixed together to form semen. This mixture is then transported to the urethra. Expulsion phase. In this phase, the muscles at the base of the penis contract rhythmically, forcing the semen out of the urethra and through the tip of the penis. This is what we commonly refer to as ejaculation. Hormonal regulation. The male reproductive system is regulated by a complex interplay of hormones. The hypothalamus, pituitary gland, and testes all play crucial roles in this process. Gonadotropin-releasing hormone, GnRH, produced by the hypothalamus. GnRH stimulates the pituitary gland to release two key hormones: luteinizing hormone, LH, and follicle-stimulating hormone, FSH. Luteinizing hormone, LH. LH stimulates the Leydig cells in the testes to produce testosterone. Follicle-stimulating hormone, FSH. FSH stimulates the Sertoli cells in the seminiferous tubules to support spermatogenesis. Testosterone. This is the primary male sex hormone. It's responsible for the development of male secondary sexual characteristics, the maintenance of muscle mass and bone density, and the regulation of libido. Common disorders of the male reproductive system. Now that we've covered the anatomy and function, let's briefly discuss some common disorders that can affect the male reproductive system. 1. Erectile dysfunction, ED. Erectile dysfunction is the inability to achieve or maintain an erection sufficient for sexual intercourse. It can be caused by physical factors, such as diabetes, cardiovascular disease, or hormonal imbalances, as well as psychological factors, such as stress or anxiety. 2. Benign prostatic hyperplasia, BPH. BPH is a non-cancerous enlargement of the prostate gland. It's common in older men and can cause symptoms such as difficulty urinating, frequent urination, and a weak urine stream. 3. Prostate cancer. Prostate cancer is one of the most common cancers in men. It usually grows slowly and may not cause symptoms in its early stages. However, as it progresses, it can lead to difficulty urinating, blood in the urine, and pain in the pelvis or back. 4. Testicular cancer. Testicular cancer is a relatively rare form of cancer that typically affects younger men. It usually presents as a painless lump or swelling in one of the testicles. Early detection and treatment are crucial for a good prognosis. 5. Infertility. Male infertility is the inability to conceive a child after 1 year of unprotected intercourse. It can be caused by low sperm production, abnormal sperm function, or blockages that prevent the delivery of sperm. Factors such as lifestyle, environmental toxins, and medical conditions can contribute to infertility. And there you have it, a comprehensive overview of the male reproductive system. From the external genitalia to the internal organs, we've explored the anatomy, functions, and some common disorders. Understanding how this system works is not only fascinating but also essential for maintaining overall health and well-being. If you found this video helpful, don't forget to give it a thumbs up and share it with anyone who might benefit from it. And if you have any questions or topics you'd like us to cover in future videos, leave a comment below. Thanks for watching, and I'll see you in the next video.